Last year, 1,207 Australians were killed on our roads. It's a national tragedy. But there's another national tragedy that is as big, or perhaps even bigger, than the road toll.
You can't help but have a sinking feeling that maybe where this patient is now didn't have to be.
You can have a woman present with a really small cancer that grows from 10 millimetres to a fungating cancer, and I've seen this happen within 6 months. I know we can avoid that.
This special investigation by Australia's Science Channel will reveal that every year thousands of Australians are suffering and dying prematurely because they try alternative treatments for their cancers. Karen Redman is the breast care nurse practitioner at the Queen Elizabeth Hospital in Adelaide, where she nurses women with breast cancer.
I focus on the surgical episode of their care, but I've been doing this for 15 years, so I have a number of long-term patients.
Karen is increasingly concerned with cases where women receive a diagnosis of cancer, then disappear from the records.
We do see people coming in that are lost to follow-up or indeed refuse treatment.
David Walsh is the head of the General Breast and Endocrine Surgical Unit at the Queen Elizabeth.
One of the things about cancer in particular is that the best outcomes clearly come from using team approach, using a specific batch of treatments to get the ultimate outcome for an individual's cancer.
So, once diagnosed with cancer, is there any compulsion for the patient to undergo medical treatment?
No, there isn't, but there is a compulsion for us to give you, as the patient sitting in front of us, the best options that we can provide. We would certainly see patients every year who, having been told of a diagnosis, given a treatment plan, will disengage from that process and seek an alternative means of care. Our experience has been that proportion is increasing. I think it's probably because things like social media and the internet allow people to see possibilities outside of what we're offering, and it's never been easier to look at alternative treatments and to explore them.
A quick search of the internet reveals many alternative treatments and cures for cancer, as well as warnings about when such treatments go wrong. And there have been some high-profile cases in recent years where people have pursued alternative treatments for their cancers only to eventually die from them. In October 2011, Steve Jobs, co-founder of Apple Computers, died from pancreatic cancer at the age of 56. He delayed conventional treatments for 9 months to pursue acupuncture, special fruit juices, spiritualists, and other treatments he found on the internet. Medical professionals claim they may have extended his life or even cured his particular cancer if they'd been allowed to act early enough. Athena Starwoman, born Helen Roosian, was an Australian spiritualist who built a global business as an astrologer and author. She rejected medical treatment for her breast cancer in favour of mind-body healing. After 7 months of herbal remedies, meditation and other alternative techniques, she admitted herself to hospital suffering from unbearable pain, but by then her condition was untreatable. She died of breast cancer, aged 59. Jessica Anscoe, the self-proclaimed wellness warrior, died of her cancer in February 2015. She rejected medical surgery for her particularly rare and nasty cancer, preferring something called Gearson therapy, involving enhanced nutrition and coffee enemas. While the medical profession are uncertain about how much more they could have done for Jessica, given her unusual and aggressive cancer, they could have saved the life of Jessica's mother if only she had followed medical treatments instead of the alternatives offered by her daughter. Sharon Anscoe died of an otherwise treatable breast cancer in October 2013. Professor Ian Olver is the director at the Samson Institute and a long-term cancer researcher.
Oh, there's always people that reject conventional treatments, but because cancer is a multi-modality disease in terms of treatments, where you might need surgery, you might need radiotherapy, you might need some sort of chemotherapy or systemic therapy, then you might select one part of the treatment but reject the others. So there's many decisions you have to make along the course of a cancer journey.
In a number of cases, women are upfront about their views, and certainly a number of the patients that I see go off and seek alternative therapies. They may go to a health sort of retreat type centre. They may be seeing naturopaths. They may even be having family members treat them, but effectively they're not having effective treatment for breast cancer.
We do need to be quite clear here that when we're talking about cancer, there is a difference between complementary therapies and alternative treatments.
We encourage patients to explore possible treatments because we don't have all the answers, and we would like to add them into a conventional plan, and that's what I think is a complementary treatment. The idea that you have to completely leave conventional treatments behind, and that these alternative treatments will only work in isolation and will be handicapped or cease being effective because of conventional treatment, that's what I think is really the dangerous idea. We're happy.
Some of them will be using therapies to complement standard therapy. The more dangerous issue is where patients elect to substitute an unknown therapy for a evidence-based therapy.
Why would a patient given a diagnosis of life-threatening cancer turn away from conventional medical treatments and seek out alternative therapies? I've come to Macquarie University to meet Associate Professor Maria Kangas, who has conducted extensive research around the psychology of cancer patients.
There's a multitude of factors as to why that may be the case. We don't have a lot of research in the field. There's some publications in the international literature indicating that it could be a person's personal values, their belief system. It could be an emotional fear factor in terms of their understanding as to what the treatment's going to entail, fear of the side effects and the repercussions that will have on their quality of life. It could also have an impact as to whether they've witnessed other close family members or friends going through such a similar ordeal and not wanting to experience a similar situation, or fear of burdening families. It could also be the faith and trust that they have in the medical system, if they've established a good relationship and rapport with the treatment team, and whether they've even had negative experiences with the health system and not necessarily linked to cancer.
And surely a diagnosis of cancer must be utterly terrifying.
Depends. If it's come out of the blue and unexpected, usually shock and dismay are quite common. There's the fear, it's understandable, the fear of the unknown. Suddenly it's a mortality issue. Some actually are relieved because they may be having sick type of symptoms or not feeling well or not quite right for a number of months. And I've had patients who are relieved to hear that something definitely is wrong with them and there is potential treatment options for them. But on the whole,
Professor Ulver literally wrote the book on complementary and alternative medicines in cancer treatment.
What we wanted to do was present the range of opinions in the one book. Because we wanted the perspectives of practitioners that dealt in alternate medicines, and we wanted the perspectives of the scientific community. We understand the desperation, but we don't want people to harm themselves. We want to.
And the main question one needs to ask is, can any of these alternative therapies actually cure cancer?
See, that's the problem. I can tell you the efficacy of all the treatments that we would deliver through our institution, and we have to demonstrate that there is a demonstrable scientific benefit. In other words, more people have to benefit from it than do not. The alternative treatments are usually based upon claims, based upon testimonials, and we are continually asking to see where is the scientific evidence that a proposed plan of care has a benefit.
They haven't actually been subjected to any sort of formal trials. So usually there's no evidence beyond a series of anecdotes. And the trouble with a series of anecdotes is even if something does work for one person, it's very important to know whether it'll work 1 out of 2, 1 out of 10, 1 out of 100, 1 out of 10,000 times, because something that works 1 out of 10,000, that's chance. That doesn't mean everyone should take it.
The lack of record keeping makes it difficult to follow just how efficacious alternative therapies are for cancer treatments. The literature is thin, but it makes grim reading. This study in Alberta, Canada, tracked 185 breast cancer patients who refused medical treatments. The 5-year survival rate was 43.2%, compared to 81.9% for those who underwent medical treatments. This Swiss study found the 10-year survival rate for women who refused surgery for breast cancer was around half that of those women who had the surgery. This US study followed 47 breast cancer patients who refused or delayed conventional treatments and took a variety of alternative therapies. They all greatly increased the risk of dying from their diseases within 10 years.
That maps on nicely into my understanding of the international literature on this, where again it confirms there is not that much a prospective record keeping, and when they do take up alternative treatments, what is their underlying motivation, and what proportion then come back to conventional treatment when it doesn't work.
Sometimes the drop-off patients re-enter the hospital seeking conventional treatment. They should be.
Well, they clearly come back usually when things are going poorly, because that is when they recognise that they have symptoms or a situation where they need help.
I've seen a number of women come back. I can recall a number that have come back between 3, 6 or 12 months after we've told them they have a breast cancer. I've also seen women come back a number of years later. They have a large fungating sore or mass on their chest. It's very difficult to dress from a nursing point of view, and they also have evidence of cancer elsewhere in their body. And I've personally sat with women that have just cried for half an hour, wailed and cried for half an hour because they're in such a mess from what was a treatable cancer a number of years ago to now being, where do you start? And it's heartbreaking when they come back. Or if they don't come back, you just don't know what's happened to them.
So how big is this problem?
I'd anticipate between 3 and 5%, and that's a bit of a guesstimate. We don't have accurate numbers, but based on the people I've seen over those years, I'd guess it'd be around there.
Once again, the lack of record keeping makes it difficult to track just how big the problem is. But if between 3 and 5% of women diagnosed with breast cancer do not show up for conventional treatments, that will be around 643 women of the estimated 16,084 new cases of breast cancer diagnosed in Australia in 2016. If these proportions hold true across all of the 130,466 new cancers estimated to be diagnosed in 2016, then around 5,218 cases will not receive appropriate treatments. This may lead to around 1,000 premature deaths every year. Perhaps surprisingly, none of the researchers and cancer workers we spoke to want to see a banning of dubious alternative cancer treatments or making conventional treatments compulsory.
So it's one thing for me to say I've got 15 years experience in cancer care, and yes, I've seen these people and I believe these treatments don't work. If you had properly constructed randomised controlled trials, for example, you'd be able to have really strong evidence. What we don't have any evidence around whether these treatments work or don't, apart from our expert opinion, which is quite strong.
I think that ultimately what an individual has for their cancer care is up to them, and they will have their own views and styles that suit them, and situations will change. What I'm really saying is not to compel anyone to not do something or do something, but I'm really saying that if you are offering cancer treatments, then you should be able to give data about your outcomes, not just one or two cases, not just your successful cases, but really produce the evidence, as we do in the conventional care system, to show that this treatment is of benefit.
So I think rather than get rid of something or ban something, I think it's a matter of empowering the consumer, if you like, by making them more aware of the sort of choices they have.
But make no mistake, there is no alternative cure for cancer, and wasting time trying to find one is all too often a fatal mistake.